The primary reason that the death rate for oral cancer is so high is late detection. By the time it becomes apparent either to the individual or to a healthcare provider, it's late stage, and the survival rate at that point is abysmal. Some 81% will perish simply because it's a late stage diagnosis. If you can catch it early, if you can catch it in early stage or in its precancerous stage, the survival rate goes up dramatically to well over 80%. Employers should be very concerned about oral cancer, primarily because, for two reasons. Certainly, as we stated before, the death rate to oral cancer is so high, it's about a coin toss. So consequently, one loses a valued employee. Aside from that, it's costly. The medical costs involved in treating oral cancer can run up to about $200,000. The primary reason for those high costs is the surgical removal and the consequent and following rehabilitations that are necessary in the head and the neck and the jaw region. So that $200,000 is not only in part removal of the cancer, but it's the rehabilitation of the head and neck and the face. Well, clearly one wants to prevent oral cancer from occurring, and the best way is to follow behaviors that don't put yourself at risk. The two classic risk factors that are well known are tobacco abuse, and if one were to smoke a package of cigarettes a day, one increases their risk by 5 times. If one abuses alcohol, which is the second risk factor that's fairly well known and associated with oral cancer, one increases their risk of oral cancer by 3 times. Particularly deadly combination is both tobacco and alcohol abuse. In combination, it increases one's risk by 100 times. About 75% of individuals with oral cancer will have either one or both of those risk factors. That leaves 25% of the population that doesn't behave in a manner that puts them at risk, such as tobacco abuse or alcohol abuse. That 25% translates to this growing population of oral cancer in Americans, which is, again, the younger individuals and women. The classic symptoms are either a red or a white patch or an ulcer in the mouth that doesn't heal. The key is that the red or white patch lingers and either is growing or remains at the same size. Only in late stages will there be bleeding, and only very late stages will one incur any pain involved. Otherwise, it's an unresolving red or white patch or an ulcer. On an individual basis, the best thing one can do is obviously avoid those risk factors such as tobacco and alcohol abuse. The third item would be to have an oral screening examination done annually. Dentists and dental hygienists are particularly trained in developing and delivering oral screening examinations. An oral cancer screening examination would involve the dentist having the patient open their mouth, obviously, and illuminating the area very well with bright light, and grasping the tongue with a piece of gauze often and rolling the tongue from left to right, as well as extending the tongue out as far as one can to look down through the back of the tongue and the back of the throat, as well as having the patient and consequently the dentist lifting the tongue to look at the floor of the mouth as well. In addition to that, dentists will often palpate, take his or her fingers and squeeze and touch the head and neck region for lymph nodes. One of the earlier signs of cancer can be enlarged lymph nodes in the head and neck and the ear region. The good news for Americans is the science and technology for early detection of cancer is improving. One of the commonly used screening tests is a screening test called brush biopsy. It actually deploys the software technology developed from the Star Wars defensive mechanism some many years ago in an attempt to defend America from nuclear warheads entering our atmosphere. And the brush biopsy applies that computer technology that was actually used to, if you will, to find the needle in the haystack, to uncover a cancer cell among normal cells. And that brush biopsy simply uses a brush, as the name implies. The dentist or dental hygienist will spin the brush over that red or white patch or the ulceration, and then submit those cells that are captured on that brush to a laboratory and a computer analysis, and within 2 to 3 days, we'll get a report back indicating whether the cells are atypical and that further workup and diagnostic measures are needed. One of the advantages of the brush biopsy technique is the fact that it doesn't require anesthesia. It's a relatively painless procedure in which the dentist rolls the brush over the lesion to collect samples of cells. The hope through brush biopsy technique is to replicate what had happened for cervical cancer with the Pap smear. When the Pap smear was introduced in 1950, it had similar death rates to what we currently are seeing with oral cancer. The hope is with the use and the introduction of brush biopsy in dental practices throughout the country, we'll get that same similar reverse of death rates, in that it translates to an earlier detection, earlier treatment, which increases the survivability of individuals with oral cancer. Delta Dental believes that dentists are in a unique position to impact oral cancer in the United States. Often Americans will see their dentist or go to a dental office more frequently than they might their family physician. So not only are dentists going perhaps a higher probability of seeing the patient, they are uniquely trained in performing an oral cancer screening examination. So we believe that the dentist in the dental office is significant in changing the pattern of oral cancer in the United States.
The hygienist noticed a small spot in your mouth today. These spots are very common. Almost everyone has them at one time or another. To keep you in good health, this office has a policy to brush all spots. There's a small chance that these spots contain some unhealthy cells. If the brush test finds some unhealthy cells, that's nothing to worry about, because it typically takes many years before the unhealthy cells can become harmful. And the spot can easily be removed before that can happen. So what we'll do today is we'll brush that spot. Here we go. Really a very simple procedure. Okay, that's all there is to it. How was it?
Painless.
Great. Okay. That's all there is to it.